College of Eye Surgeons, and then other organizations. And I am sure IAPB, having there so much of connectivity to many other organizations working on eye care services globally, will be able to get and mobilize resources, especially human resource, until such time we have enough eye surgeons. If you go by the WHO recommendations, we need to have 200 eye surgeons. That's with the 0.7 prevalence of blindness. But this is 1.7 or even more than that in certain provinces. So we need to double that amount also. But we have 25% of that recommendation at the moment. So PGIM, Ministry of Health, College is supporting to increase, but there's a time period where you can't increase the eye surgery. It takes time where we need to get the support from other countries. So I'm sure that you all will make a robust recommendation on this. Then refractive errors. Again, we need to expand our services. I think we have somewhat better services at the moment, but we need to expand it. We have started with satellite clinics to identify. We have a very strong primary eye care program. Probably we need to revive it, revamp it, and then establish more satellite eye clinics to identify refractive errors. And then, of course, the government will decide, like we have decided by the Honorable Minister when he had a meeting with the college, to provide IOLs to each and every patient who need it. So that's what we are going to do, provide IOLs to each and every patient who need it. So nobody need to buy it from outside, that's our intention. So likewise, maybe spectacles, we need to take that policy decision. And if you buy large quantities, prices will come down and you can have a good quality one. So we need to take a decision on that. Then the glaucoma, of course, we have a awareness program, we have to expand it, and the other courses. I'm sure you will deliberate on that. And if you go by the conclusions of the survey, good visual outcomes after cataract surgery is 59.7%, which is very much lower than the WHO recommendation. So we need to start a program to collect data and then review monthly cataract outcome. That's bad. That's not good. Sri Lanka is known as a country which deliver excellent health services, and different countries are coming to Sri Lanka. Now, last week we had the minister from Bangladesh with the 8-member delegation came to Sri Lanka to study our primary health care services, and they were really impressed about what we are doing here. So we need to impress others by having excellent eye care services as well. So we need to discuss and see how best we can address this issue. We are below WHO recommendation, which we cannot accept. So we need to seriously deliberate on this. Then poor visual outcome after cataract surgery is 12.1%, again higher than the WHO recommendation. So I think the blindness survey is eye-opener for all of us to sit back and think seriously. Then cataract surgical services are very less for those who are illiterate, rural people, elderly, those socio-economic. That is the group we need to address. So that's why we thought we should come out with this Vision 2020 program, globally and regionally and within the country. So if we don't address that, if only the rich crowd get their services, I think we are not rendering equitable services in Sri Lanka. So we need to address this outcome of the survey. Cost is the principal barrier. So we need to provide free services. Cost for the lens is very high. Many cannot bear it. So government has to provide it. Then whatever the rest of the cost, maybe for traveling and all, that will be minimized if we have eye units everywhere. People need not to travel, so those are the areas probably we need to focus. So new challenges, maybe because our demography has changed, epidemiological pattern of the disease have been changed. we have high prevalence of blindness. Maybe also we have not provided the enough services. We have not done enough cataract. So finally blindness prevalence is high, which we need to address. Very high prevalence in some areas, as I mentioned. Those areas we need to come out with special strategies and programs. Mark cataract blindness, which is not good for our health services, which is preventable, so we need to address it. Poverty and poor access, major causes for cataract blindness, we can't accept because we are having a free healthcare services. We are telling the other countries in the world we have a free healthcare services from vaccination to neurosurgery and bypass, we are providing free of charge. But finally we find cataract is not done because of poverty. So we need to rethink and reshape and re-engineer our strategies. And increase cataract surgical complications, I think we need to have more and more training programs. So, role of the Vision 2020, that is all of us, is to see how to overcome these challenges. I don't want to go one by one. We have the best crowd here who have been committed for last so many years for Vision 2020. Each one of you have gone beyond your normal duties. You have done so much extraordinary to make us at least successful to the extent we are successful. But we need to do much more, for which we need to have much more commitment from you. So I am very much optimistic that we can reach our goals. So we have focal points from the college. Each area we have a eye surgeon, a senior eye surgeon. I think we need to meet frequently and see how is the progress. And we have supportive organizations, WHO represented here, our professor is here, so she will take the message to WR as well. We need to get much more support, Nalika, from WHO. And last few years we didn't see much. Maybe globally the program has been seen to a level where support is less. And when I went to Geneva last time, I had a discussion with the focal point in Geneva as well. So they wanted to again come back and extend their support. IAPB is always supporting. And there are many other NGOs, nationally and internationally, who are supporting, and also philanthropists and well-wishers. So we need to get many others getting involved. So I think this is the best forum to identify and formulate strategies to address the current issue. So as I said, you are the best out of all we know. That's why we have invited you. So I am sure during next 2 days you deliberate and come out with good strategies so that the challenges we have mentioned will be overcome. I thank you.